We worked as hard as we could to protect people who live in care homes. And of course, those who live in care homes are some of the most vulnerable to this disease because by its nature, it attacks and has more of an impact on older people. Now, when it comes to the testing of people as they left hospital and went into care homes, we committed to building the testing capacity to allow that to happen. Of course, it then takes time to build testing capacity. And in fact, one of the critical things we did was set the 100,000 target back then to make sure we built that testing capacity, and it was very effective in doing so. And then we were able to introduce the policy of testing everybody before going into care homes. But we could only do that once we had the testing capacity, which I had to build, because we didn't have it in this country from the start. You know, we started with a capacity of less than 2,000 in March last year and got to 100,000 tests a day. We set all of this out at the time in public documents. It's all a matter of public record. I mean, we worked closely together on it, Jenny.
I think I might just add to that, from a professional perspective, I think the testing is clearly important, and as Secretary of State has noted, we have built a lot of capacity. This is all readily available now. We do around 1 million tests a day. But I think actually one of the things that sometimes gets forgotten in some of the conversations about testing is the really important thing is not testing says you have a problem. The intervention is very much about isolation. So when an individual leaves, whether it be a hospital setting, the guidance is very much about ensuring that there is appropriate infection prevention control, both in the care home setting, but actually in separating that individual from others, because the test only gives you the result on the day. The really important thing is to be able to be sure that a patient doesn't become symptomatic and be able to transmit infection for the subsequent incubation period. So from an interventional perspective, that is critical. Testing is really helpful. And I think the only other thing I would say is it's, you know, the elderly and the vulnerable in residential settings have been a focus actually of a care subgroup in the SAGE modelling group. And actually I chaired that group specifically to try and understand precisely where the risks were, predominantly in residents going into care homes and because of the very high infection rates. And there were 2 pieces of work commissioned around that. And although the data is quite complex to interpret, it was very clear at the end of this work that there are different ways for the virus to come into care homes, and it can come from a hospital discharge, but that is definitely not the majority route of entry. It's coming as community cases rise, and care workers are going in and out as they do because we need them to provide care. It's coming in with community rates, and we see that with schools as well. So I think it's just about really looking at the evidence of where transmission occurs, which is important.
Thanks very much, Laura. Next question is from Carl Deneen from ITV.
Hi.
Secretary of State, you've explained why you didn't test everyone going from hospital to care home, but the charge from Dominic Cummings is actually quite specific, and I'd like to try again on that. Did you tell the Prime Minister that everyone going from hospital to care home would be tested, or is Dominic Cummings not telling the truth on that?
Of course, we committed, and I committed, to getting the policy in place, but it took time to build the testing. You know, we didn't start with a big testing system in the UK, and then we built that testing system, and that's why the 100,000 target was so important, because it really accelerated the availability of testing. Because when you don't have much testing, we had to prioritise it according to clinical need. And so that was the approach that we took. In fact, we set all of this out at the time. But you know, it is important in terms of looking back on it that what we had to do was build the testing capacity, because there simply wasn't at the start of the pandemic that testing capacity in place. We had to put it in place, and that's the action that I took. Thanks very much. The next question is from Beth Rigby at Sky.
Thank you, Secretary of State. Just to follow up on that, and specifically, Mr. Cummings said yesterday that you categorically said in the Cabinet room in March that people were going to be tested before going back into care homes. Mr. Cummings went on to say that he and the Prime Minister subsequently found out that hadn't happened. He said, far from putting a shield around people, they were sent back to care homes untested. So just to be clear, did you make the statement in March that they would be tested before going back to care homes, and that didn't turn out to be true because you didn't have the testing system in place? Is that what really happened?
No, look, there'll be a time when we go back over all this in great detail. But my recollection of events is that I committed to delivering that testing for people going from hospital into care homes when we could do it. I then went away and built the testing capacity for all sorts of reasons and all sorts of uses, including this one, and then delivered on the commitment that I made. And that is that's kind of normal way of how you get things done in government. You work out what needs to happen, you commit to making it happen, you go away and deliver on that commitment, and then you can put the policy in place. And there'll be a time when we can go through all of this in greater detail. The most important thing right now is that we've still got a pandemic to handle and to manage, and hence the announcements that we're making today on vaccination and the work that we're doing to try to make sure we keep this epidemic under control.